Hello, everyone. My name is Dr. Fred Hirsch. I'm a professor of medicine at Icahn School of Medicine at Mount Sinai. I'm also the executive director for the Center for Thoracic Oncology at the Tisch Cancer Institute at Mount Sinai in New York.
What are the different types of lung cancer?
So lung cancer can be divided in two main types. We are talking about non-small cell lung cancer, which is about 80% of the lung cancer patients. And we are talking about small cell lung cancer, which is a minor subtypes of lung cancer. Within the non-small cell lung cancer type, there might be some subtypes based on the tissue examination. We are talking about adenocarcinomas, which are the most common subtype within non-small cell lung cancer. And the other main subtype is squamous lung cancer, which is within the non-small cell lung cancer a minor subtype. So that is briefly how we group the lung cancers. It is a main difference in treatment between non-small cell lung cancer and small cell lung cancer. Within the group of non-small cell lung cancer, the histologic subtypes, or what we see in the microscope, do not necessarily lead to a differential treatment.
What are lung cancer's risk factors?
The risk factors for lung cancer, well, the main risk factor is very clear and have been known for decades. That is, of course, tobacco smoking. However, 15 to 20% of the lung cancers today are in never smokers. So what are the main factors related to never smokers? Well, we know that secondhand smoking is representing a risk factor. We also know that some environmental factors like radon also represent a risk for lung cancer. There might be other environmental factors playing in as well, and that includes air pollution, without our ability so far to clearly point to which factor in the air pollution plays a role. We know about other risk factors as well. We know about family history can play a role, hereditary factors. We don't know exactly what that means on this stage. The germline mutations, whether that play and which extent it plays a role. Beyond that, we know that pulmonary diseases in never smokers could play a role. We know that for chronic obstructive lung diseases, which seem to represent a risk factor for lung cancer. But the bottom line is, of course, that tobacco still plays a major risk factor, and a strategy to reduce tobacco consumption or smoking is certainly high priority. But unfortunately, we see an increasing prevalence of lung cancer in never smokers.
Can lung cancer be detected early?
Lung cancer can absolutely be detected early, particularly through screening with low-dose CT in a specific defined high-risk group. We know that lung cancer screening in individuals with smoking history, we defined that previously with what we called 30-pack-year history, and I can explain what that means, and an age of 55 and over. We know that lung cancer CT screening could reduce the lung cancer mortality with 20% or more. Today we have data from larger studies, particularly from Europe, indicating that even in younger patients, the studies are down to 50 years of age with a lower history of tobacco smoke. We are now talking about 20-pack years of tobacco history. We can reduce the lung cancer mortality with up to 24-25%, even more in a smaller group of females. So the answer to your question is clearly yes, lung cancer can be detected early, and when it is detected early, it means a lot for the prognosis and lung cancer mortality.
How is lung cancer diagnosed? How are lung cancer stages determined?
So lung cancer diagnosis is detected in different ways. Most of the patients are seeking a doctor because of their respiratory symptoms, and the doctor, based on symptoms and other factors, will recommend in certain cases a step further, recommending a low-dose CT or recommend visiting a pulmonologist. The diagnosis is at the end of the day based on a tissue examination. This tissue can be obtained either through a biopsy from the primary tumor or a metastatic lesion, or it can be through surgery if the patient undergo surgery based on the finding, the radiologic finding on CT. So that is mostly how lung cancer is diagnosed these days. How is lung cancer stages determined? Well, staging is important for treatment decision. And we are talking about localized disease, which when in the case where tumor is confined to one place in the lung, we are talking about local regional disease if the scan pointing to spread to local lymph nodes in the chest. And we are talking about advanced disease if the disease unfortunately has spread beyond what I mentioned for localized or local regional. Technically, we are talking about stage 1, which is localized disease, to stage 4, which is advanced disease. And again, the treatment options are different from stage 1, stage 2, stage 3, or stage 4. So staging is important for treatment decision. The prognosis is, of course, also some kind depending on stage. In general, the prognosis is better as early stage the disease are diagnosed. However, the prognosis can be good also in more advanced stages due to all the progress we have done within the recent years with new treatment options for patients with more advanced disease. Those new treatment options include what we call molecular targeted therapies, where we have the treatment, which often is a tablet, a pill, directly targeting a mutation. But we have also progress in what we call immunotherapy for patients with more advanced disease. So altogether, the prognosis for patients with more advanced disease has certainly become much better over the last few years due to significant progress in treatment options. For patients with early disease, the prognosis is still very good. And if we should talk prognosis, if you come to early stage disease, diagnosis of lung cancer at an early stage, your cure rate can be 60 to 70%, depending on the size of the tumor. But again, we should certainly see lung cancer as a disease where we have achieved a lot of progress independent of stage of disease.
So what treatment options are available for lung cancer?
The treatment options for lung cancer is, as I said, depending on stage. If we are talking early stage disease, some patients will just be offered surgery. Most likely today, we will add to the surgery immunotherapy or chemotherapy, or if the patient have what we call EGFR mutation, we will add a specific EGFR targeted therapy. So that is the most localized disease, either surgery alone or surgery with added treatment. If we are talking local regional disease, that will be stage 3. We will treat these patients with a combination of radiation and chemotherapy, and added to that immunotherapy. If you are talking stage 4, which is the most advanced stages, as I mentioned before, this will include what we say systemic disease, either with a molecular targeted therapy if we have an identified and treatable mutation. Otherwise, we will give the patient immunotherapy with or without added chemotherapy. So those are the treatment options, again, depending on stage of disease at time of diagnosis.
Can lung cancer be cured?
Lung cancer can absolutely be cured, particularly if you detect lung cancer at an early stage. As I said, in the most early stage, the cure rate, which we in practice will say living more than 5 years and beyond, that is what we will probably call a curative treatment. If you have a localized disease, the cure rate can be up to 60-70%. Of course, the cure rate goes down as more advanced disease the patients present with the encouraging news that even in more advanced stages, we have significant prolongation of survival with new treatment options. I will say in many cases, we will probably consider lung cancer as a chronic disease in many situations where we have a new treatment option. But we need to better figure out how do we select the right patients to the right treatment, and what are the best way to predict outcome. But in general, we have done a tremendous progress in lung cancer treatment over the last 5-10 years, both for early stage disease and for advanced disease. 10 years ago, the cure rate for all lung cancer patients, and that include early stage disease and advanced disease, was down to 15-16%. Today, we are realistically talking about a cure rate exceeding 20% when we take all stages into account. And that is a significant progress over a relative few years. And as a lung cancer doctor and scientist, I'm confident that further progress in cure rate and treatment options will occur rapidly over the next 5-10 years.
Do all lung cancer patients require surgery?
No, not at all. As we mentioned before, it depends on stage of disease at time of diagnosis. Early stage disease will require surgery, either alone or with additional treatment, either with additional immunotherapy, chemotherapy, or molecular targeted therapy. And if it is stage 3, we will add a combination of chemotherapy and radiation and immunotherapy to surgery. But in more advanced diseases, we will not offer surgery, but we will only offer what we will call systemic therapy. So again, surgery as a primary treatment is depending on stage at the beginning, and as earlier we find the stage as more relevant is surgery. A surgical procedure can be relevant in other situations. That could be removal of a single lesion or another lesion, but that is more rare cases. The primary treatment is, as I mentioned, based on stage of disease.
What should patients expect with lung surgery?
Well, if you are talking expectation in terms of outcome, if the patient are presenting with early stage disease, the cure rate is very high. As I mentioned, even in localized disease, where you have a small tumor localized one place in the lung, the cure rate can be up to around 70%. With added treatment in more advanced stage, even there the cure rate is significantly better today than ever have been. And we have patients with advanced disease which have been treated with molecular targeted therapy, where we can talk about significant long-term survival, more than 5 years in many patients. And we, as I said, in some situations, I will characterize the situation as lung cancer as a chronic disease. But everything comes back to a stage of disease. That is why lung cancer screening is important, and the molecular characterization of the patient's tumor. That is why molecular testing of the patient's tumor is crucial for getting the right treatment to the right patient.
So, how does the lung cancer program look like today at Mount Sinai?
Thank you for that question. It has been a great opportunity for myself to come here 3 years ago to direct the lung cancer program at Mount Sinai. And we have really developed the program very rapidly. Today, we have a large number of clinical trials to offer patients in all stages of disease. We have a variety of clinical trials for patients with what we call a molecular targeted mutation. We have also many opportunities to offer patients immunotherapy in all stages. And we have developed over time, that was before I came to Sinai, a very extensive lung cancer screening program. So it has been a pleasure to see this rapid development. We are offering the patients today the top treatment for lung cancer, and we have a wide range of scientific programs going from early diagnosis of lung cancer to treatment of advanced disease. So we are continuing to develop our program, and the goal is to offer patients world-class treatment for lung cancer.